Hello juniors, so I welcome you all again in the continued series of lower limb, and today we are going to cover an important topic which is the femoral sheath. So in today's video we will be covering its introduction, contents, femoral canal. So this femoral canal is an important topic frequently asked in university exam. So you must prepare this topic and its clinical relevance. So without wasting any further time, let's move ahead. So starting with the introduction of the femoral sheath. Firstly, coming to the name of the femoral sheath, what does that implies? So femoral means something related to femur, and sheath is a sheath or a fascia covering or anything you can understand as something as sheath. So femoral sheath is a passageway in the upper thigh that allows vascular and lymphatics to pass from abdomen into the thigh. So showing you what is this. So firstly orienting you where we have to find the femoral sheath. This is by our animation. So right here, this is the anterior superior iliac spine, pubis tubercle and inguinal ligament. So posterior to the inguinal ligament lies our major vessels, and these vessels are encapsulated by that femoral sheath. So this is what I have shown you here. So this is our femoral artery, this is our femoral vein, and these are the lymphatics. So these three structures are encapsulated by this femoral sheath. So femoral sheath, the lateral wall is vertical, medial wall is oblique and directed downwards. So the lateral wall is vertical, medial wall is oblique and directed downwards. Once again, this femoral sheath encapsulates the vascular and lymphatic structures that pass from abdomen to the thigh. The anterior wall of the sheath is formed by fascia transversalis. So what is the fascia transversalis? Fascia transversalis is present in the anterior abdomen and it covers the transverse abdominis muscle. So the anterior part of the femoral sheath is formed by the extension of fascia transversalis. The posterior wall of the sheath is formed by fascia iliaca. So once again, this fascia iliaca is a covering that covers iliacus muscle. I'll also cover these fascias and the layers of abdomen in greater detail in my video on abdomen. But for right now, you have to remember the anterior wall of the sheath is formed by fascia transversalis and the posterior wall of the sheath is formed by fascia iliaca. So this is the isolated picture of our same femoral sheath. So this is our femoral artery, femoral vein, lymph node and its related lymphatics. This whole sheath encapsulates these vascular and lymphatic structure coming from abdomen to the thigh. So the anterior wall of the sheath is, as I've already told you, is formed by fascia transversalis, which is the fascia of anterior abdomen covering the transversus abdominis muscle. And the posterior wall of the sheath is formed by fascia iliaca. So this is a one more diagram from BDC. Many students find it challenging, and they aren't oriented about where the author is trying to show the structure in the body. So this is the orientation. We are viewing the part from lateral view, and here the artery, vein and lymphatics are present. So what you will be able to see here, this is the anterior most and this right here is the posterior. So you are viewing the cross section of the body. So this is our anterior abdominal wall and you are able to see that femoral artery. So this is right here will be the sheath which we have cross-sectioned it. So the anterior wall of the sheath, this is the transverse fascia transversalis. As I've already told you, this fascia transversalis covers the transversus abdominis muscle of the abdomen. So fascia, the anterior wall of the sheath is a continuation of fascia transversalis. It continues, it extends downwards, and it continues and gets blended with the fascia iliaca. This is the fascia iliaca, which is covering the iliacus muscle. So the big story right here is that fascia iliaca forms the posterior wall of the femoral sheath, and the transverse fascia transversalis forms the anterior wall of femoral sheath. They both merges at the inferior and forms the femoral sheath. So what are the contents of femoral sheath? As I've already told you, this is only an imaginary depiction showing you the femoral sheath. So the sheath is divided into three compartments: the arterial compartment or the lateral most compartment. The sheath is further divided into arterial and the venous and the lymphatics compartment, out of which arterial compartment is the lateral most. The compartment contains the femoral artery and the femoral branch of genitofemoral nerve. In this diagram you can appreciate this is the femoral branch of genitofemoral nerve. Second one is the venous compartment or the intermediate compartment. Right here, this is the intermediate compartment. All these compartments are separated by a septa. So this intermediate compartment contains femoral vein. And thirdly, the lymphatic compartment, also the medial most. This is the lymphatic compartment, also the medial most of the all of three, also known as femoral canal. Here comes our topic, the femoral canal. This compartment contains the lymph node and lymphatics. Lymphatics are the lymph vessels. So this medial most compartment is also known as our femoral canal. Giving you a brief intro of this femoral canal. This femoral canal contains the lymph node and lymphatics. This is an inverted cone shaped structure. As you can appreciate, this is an inverted cone shaped structure with its base facing upwards. So now basically coming to the femoral canal. This is the medial most compartment of the femoral sheath. So if these two compartments were dedicated to artery and vein, this third compartment, the medial most compartment, is our femoral canal. Femoral canal is an inverted cone, as I've already told you. If you make such thing like here, and it becomes an inverted cone. Base being wide and above. The base is facing upwards, narrow below, and that is narrow downwards. It is 1.5 centimeter long and 1.5 centimeter wide. So this is 1.5 centimeter long and this is 1.5 centimeter wide. The femoral canal contains a lymph node of Cloquet or Rosenmiller, lymph vessels, and small amount of areolar tissue. Right here is our femoral canal, the inverted cone shaped, and it would contain lymph node of Cloquet or Rosenmiller. So these names come from the anatomists, which were the Johann Christian Rosenmiller and the Jules Cloquet. So why specifically the lymph nodes present in this area assigned a name, but other lymph nodes present in the different other locations of the body are not given? This is because these lymph nodes are considered as sentinel lymph nodes, means any malignancy spreading to the lower extremity or metastasizing to the groin area or lower extremity, these are the first lymph nodes to get swollen or to show lymphadenopathy, showing you a sign of metastasis. Lymph vessels and small amount of areolar tissue, that is fatty deposition. Base or upper end of femoral canal is the femoral ring. So if this is our femoral canal, the base right here, the base would be called as the femoral ring. The femoral ring is important from clinical point of view. We'll also discuss that the boundaries of femoral ring is important. So the femoral ring is bounded anteriorly by inguinal ligament. As I've already told you, if this is our femoral canal and the base of the femoral canal is known as femoral ring, so this femoral ring is bounded anteriorly by this inguinal canal, this inguinal ligament. Medially, the femoral ring is bounded medially by this lacunar ligament. This is the lacunar ligament which forms the medial boundary of femoral ring. Posteriorly, it is formed by the pectineus muscle and its covering fascia, and laterally from the septum, separating it from the femoral vein. So going once again to the anterior, it is bounded by inguinal ligament, as I've already told you. Posteriorly, it is bounded with pectineus muscle and its fascia. Medially, it is bounded with lacunar ligament. And laterally, it is bounded with the septum of femoral vein, as I've already told you. Now coming to the clinical relevance of this topic. So that are the femoral hernias. So what is a hernia? First of all, hernia is a bulging of an organ or tissue through an abnormal opening. So as the person ages, the femoral ring or the femoral canal gets susceptible or gets weakened, due to which the intestinal loops may herniate through it to forms the femoral hernia. These femoral hernias are more common in females. They lie below the level of inguinal ligament. Inguinal hernias are also very common, but we will distinguish femoral hernia and inguinal hernia on a separate video. So completed with the topic of our femoral sheath, covered its introduction, contents, femoral canal, and its clinical relevance. If you found this video helpful, do like it and do share it with your friends. Thank you.